Have you ever tripped over nothing? Maybe your toes caught a tiny crack in the sidewalk, or you just didn't lift your leg enough. It's annoying, embarrassing, and maybe even a little bit dangerous. Now imagine that happening every step you take. Walking becomes scary and exhausting. This is how a walking problem can become a quality of life problem, affecting independence, social life, and even mental health. For over 6 million survivors of stroke in the United States, this is their daily reality. My name is Jenn Bartloff. I'm a physical therapist and engineer, and I'm a postdoctoral researcher at Shirley Ryan Ability Lab and Northwestern University. After a stroke, it's common to have weakness and poor control of the leg, especially when it comes to lifting the foot while walking. Every step becomes a gamble. Will your toes clear the ground, or will they scuff and trip you up? To lower this risk, many survivors of stroke adjust their movements to help their foot clear the ground. These adaptive movements are tiring and can cause long-term wear on joints, potentially leading to chronic pain. As a physical therapist, I think about 3 main ways to help someone walk more naturally. We can help change their body by making them stronger or putting a brace on them. We can change the task, like asking them to step differently, or we can change the environment, making it easier or more challenging to walk. Right now, one of the main ways that we help with this problem of foot clearance is to use a brace that goes into the shoe and straps onto the lower leg. But this only gets us so far. With bracing, the risk of scuffing and falling is reduced, but it's still possible. Bracing can be clunky and uncomfortable. They don't fit well with every shoe, and they can be hard to get on and off, especially with one hand. The appearance of a brace can draw attention to the disability of the person wearing it. And for any combination of these reasons, many people stop wearing their braces altogether. As a scientist and clinician, my biggest concern with bracing is that it restricts natural ankle movement, possibly limiting the potential for recovery of muscle control. In my research, I'm studying a new approach to this problem, one where scuffing the ground is made safe and the possibility of natural motion and recovery are unrestricted. The solution is a shoe. The shoe behaves normally most of the time. The only exception is when your toes start to drag. Watch how the shoe is gliding across the ground. Instead of catching and tripping, the underside of the shoe has become slick, like you're gliding on ice. You don't stumble, you don't fall, you just finish your step and keep walking. The underside of the shoe changes depending on whether you're scuffing or not scuffing, because the grippy rubber part is recessed from the slick, hard plastic pucks. The grippy part only kicks in when you need it to, and the rest of the time, the slippery pucks are ready to take on a scuff. While bracing gives the same type of assistance each moment that you're walking, this shoe is more subtle. It only provides that assistance in the moment of need without interfering the rest of the time. In my research, we're testing this shoe with people who've had a stroke. We're comparing it to the usual bracing approach, and we want to answer the following questions. Does it help people walk faster? Does it help them move more naturally and with less energy? Are they more stable? And does it help them recover muscle control and strength? And do they actually like using it? Instead of just modifying the person through bracing, this shoe takes a more holistic approach by changing the interaction between the person and their environment, allowing more natural movement to occur safely. In our study, this allows us to also change the task. We're teaching our research participants to reduce those unwanted adaptive movements. We're just getting started. This new approach to gait rehabilitation has potential benefits to anyone with foot clearance problems. For example, people with multiple sclerosis, spinal cord injuries, cerebral palsy, brain injuries, or peripheral neuropathy could benefit from this shoe and learn to make their walking safer and more efficient. As we continue to explore this technology, the idea behind my research is to make walking more efficient and safer for everyone. Thank you for watching.